everyone, so welcome to the first Courageous Conversations in Trans Healthcare. This first session was specifically focused on medical students and healthcare students, looking at how we're going to improve trans non-binary inclusive healthcare in UK healthcare education. So we did record most of this session. We forgot to record the first bit, so this is just a bit of cover and an introduction of the speakers so that you can watch the whole thing if you didn't get a chance to be there on the day. So my name's Chloe. I'm the founder of 16.6, an LGBTQ+ inclusive healthcare education website, and we make resources for healthcare students and healthcare professionals to learn more about trans and LGBTQ+ inclusive healthcare in order to improve their practice going forward and to improve the healthcare experience of trans people. My co-host is Tara, and she's going to introduce herself.
Hi everybody, I'm Tara Hewitt. I'm the founder of the Trans NHS Staff Network, and it's a real privilege for us to be working together with 16.6 and Chloe to run these series of events to help improve knowledge and awareness about trans inclusion across healthcare.
And I just also want to say at this point, thank you to Lucas and Laura, who are our guest speakers on this session, both current medical students and really well up and informed on all the content that we're talking about today. So thanks to them for being here. So this was discussion one. I'm just going to give a quick overview of what happened. Essentially, the outcome from this was that the content to be included should be holistic. It should be healthcare as an overall banner, not just gender affirming healthcare. It should be all about the healthcare that trans people will access as human beings, and therefore applicable to all healthcare students in all different disciplines. And in terms of how we wanted trans and non-binary people to be included in creating this content, there was an overarching theme of cis people needing to do a lot of the legwork and a lot of research themselves, and not to put the burden of content creation onto trans and non-binary people who, you know, yes, they live this experience, yes, they have a lot of knowledge and a lot of knowledge that we can use and learn from, but it shouldn't be just focusing on them doing all the work whilst we sit back and just reap in the benefits.
Really great conversation so far, and it's great to have had that mix of people able to contribute who have joined us from Eventbrite and our fabulous panelists, and actually bringing that real experience of where our med schools are now and where teaching is now today and where we need to take it as we move forward. But actually, with that in mind, we've talked about the environments that trans and non-binary people can face, and the environments that our med schools create at the moment, and the environments that our teaching hospitals have right now, that actually more than ever now is the time to speak up, and now is the time that we need trans allies and people that are seeing that transphobia in real life, and that ignorance and that absence of inclusion, actually being willing to challenge and actually really say that isn't acceptable, and we need to create more inclusive spaces. But that can feel really difficult. That can feel like, actually, how do I do that and still maintain my professionalism? How do I do that and protect my well-being, and actually the impact that might have on me in speaking up? And how do we create an intentionally inclusive space, recognising the experiences that trans and non-binary medical students will be having outside in our communities regardless? And actually, it's not enough just to make our environments inclusive internally, but actually to recognise what people bring and what impact weathering has on our medical students. So I'm just going to open it up to our panelists just to say that the first question is, how do you challenge transphobia while maintaining that professionalism? So who wants to go first?
I mean, I was just going to put in a 2 cents about sort of how I know that my medical school approaches this kind of professionalism topic, and there's a lot of clinical communications that we do. I know lots of medical schools do similar things where essentially you get either patients or actors. We had actors who come in and they pretend to be patients, and you have to have a conversation with them, and the point of the session is not to test your clinical knowledge but to test how well you're able to talk to your patients and make them feel comfortable and reassure them about certain things to do with their healthcare. So I know that that's how we go about it in Birmingham, just for a bit of context. So, but I'd like to pass over to Lucas and Laura, sort of, to take the lead on this one.
I'll go first because you've gone for, you've had first blush, just because I don't want to take up too much time. Again, I'm looking at the checklist. It's so interesting seeing everybody's contributions. How do we? Can you just repeat the question in a sentence, just so I don't get too off topic? Sorry.
So how do we challenge transphobia while maintaining professionalism?
Oh, I don't. I am not out at work. Nobody tell. Do you know what I mean? But as in, I wouldn't offer that, or bring it up. And I haven't when it's happened, because I am not in a position to be doing that. Or rather, I don't feel safe doing it. Do you know what I mean? I might bring it up after the fact or whatever, but in terms of, like, in the incident, in the moment, it's very hard for, like, me, a trans woman, to go in and be like doing also. And I think part of it as well is that, like, and again, like, it has been mentioned about, like, how the trans people in medical schools thing. So I don't want to sort of draw too much or generalize too much my own experience and the experience of my medical school. And before I do, I think it's important to note one of the issues that we're coming up against again and again is it's everyone giving local examples of how people are trying to do it themselves. Do you know what I mean? Of individual med schools being approached by interested individuals or motivated people who want to sort of increase that that understanding and that knowledge base for people. But because medical schools are very much, up to a degree in terms of the curriculum that they're able to provide, are sort of laws unto themselves. The way in which they want to organize their teaching, the ways in which, they wish to deliver their content is ultimately up to them. And they perhaps fairly turn around and say, look, we don't have space. And the argument is obviously make space. But, I think the heterogeneity, the picture, the patchwork sort of picture that we have in terms of both the experience of trans people within healthcare, do you know what I mean? Which can be very localized and very sort of dependent on having individuals who are sort of champions for that. It's something that sets us back, because it means that you're constantly trying to basically play at the speed of the the people who are just coming back up to or accepting things that other people are trying to push ahead with. And just on the sort of there being trans people in med school thing, I don't think you're going to be seeing sort of many openly trans people in med school, or like as many as one should, quote unquote, if we were to go off the population estimates. And again, I remember, and again, I don't want to sort of be, I haven't spent most of my time sort of thumbing through my med school's annals to try and work out who's trans. But of the trans people I know of in my medical school, which is about 4,000 people, there's probably less than 5 trans people across all of the years. And, I'm sure we can all work out that it's probably not as many as there could be. So it's either, trans people are really not liking becoming doctors, or there might be issues that are stopping people.
Well, Laura, I'm gonna ask you to park that one to the next topic, so we can actually really look at what can we do about that, and how can we really make sure that we have trans and non-binary people in the medical profession in more numbers as we move forward. So that's absolutely something that we need to pick up. Can I just ask Lucas, just actually what's your reflection, Lucas, in terms of how do we challenge transphobia when we see it around us, or how should people challenge transphobia if they see it?
So I'm a third year, so I'm really just kind of coming into the clinical environment in which like professionalism is like properly considered. But I think we need to also, within this, question what professionalism is and what that looks like, and we need to make sure that people who are in positions of power and have like educate professionalism or evaluate that, really consider what that looks like, because people within minority groups, especially looking at people of colour as well, are have like much tighter restraints on what is deemed to be professional, which means that when we do raise our voices on things, or we dress or express ourselves within like the workplace or the educational environment, we're kind of aware that we have like tighter constraints on that. So I think it's really, really important that we have people who have our backs. I think that's something that's I've especially been learning recently. All the people that, right from freshers when I didn't know them, were challenging quietly, just like speaking up, going, actually, this is how it is, or like gently explaining things without relying or requesting voice from those of us that it was affecting most. And I really, really valued that so much, and that's what's necessary. It's necessary to have the people you know you can go to. I think similarly to Laura, I don't really feel safe in so many situations where transphobia occurs or is overheard gently in the student common room. It's so uncomfortable, and so realistically, I'm still reliant on people around me checking in on me and gently challenging, even just little stuff like when I have to write a strongly worded email to tell someone to get to allow my correct name to be on a register, so to allow me to not be outed to the entirety of Birmingham, just read over that email, offer the small little admin things that just mean that we can exert a little less energy. I think it's so much, yeah.
Energy is such a good point, because I know there's so many trans non-binary people who literally spend, so much of their time just trying to get through their day, just to do the normal things that everyone else is allowed to do completely on their own. And I'm not trans, and I'm so conscious of the fact that a massive, possibly even the biggest part of the problem is that cis people don't call out transphobia when they should, and that in a professional setting that's so important, because anyone who's ever worked in hospitals knows that there is such a hierarchy, particularly in medical teams, I'm sure especially in nursing teams and physio, I'm sure everything has it. Medical teams, I've no doubt, are the worst. Talking as a junior doctor, the hierarchies aren't real, and I can't even imagine what that's like for a trans person to have to deal with that when they're constantly having to either defend themselves or hide themselves. And I think there is a lot to be said for medical schools, particularly working to tell their cis students that they are a massive part of the work towards a solution for this, in that they need to call out transphobia when they see it, whether there's a trans person there or not.
I think what's really interesting for me in hearing that, and hearing what you've just said, Chloe, as well, is how few spaces I see cisgender people centering trans perspectives and actually centering the need for trans to be built in. But I was heartened for the first time in a real meaningful way. I was lucky as a senior manager to be on a call with colleagues from NHS England and senior leaders of chief execs and directors and some other trans and non-binary colleagues from across the country as part of some consultations on our future people plan. And actually the message coming out from some of our cisgendered leaders was the first time I'd really heard it, was cisgender people saying trans issues matter, trans issues need to be discussed, they need to be focused, we need to call out transphobia. And I know that other colleagues who are on the call today, some of them were on that call that might be listening, but that was the first real time I've ever, in my experience working in equality in the NHS, heard senior leaders centre, or cisgender colleagues centre trans issues in such a strong and clear way. And if we don't get more of those spaces, many of us who are trans and who don't hold some of maybe the privileges that I hold in terms of my position, my ethnicity, my class, and who actually might feel even more vulnerable in speaking up and speaking out, is that things won't change, and it is going to take cisgender people consistently challenging, consistently showing that there are spaces for things to change for the future before trans people feel like they can speak up more than we already are, because many of us are becoming tired in having to speak that up. I think there's a colleague who wants to come in. I think is it Becky that wants to come in again?
Hi there. Yeah, just two practical kind of how do you challenge. I think they've been vaguely covered, but I suppose we say transphobia, but we also mean non-binary phobia. Is that a word? Anyway,
Ambiphobia. But yeah, absolutely.
Often communication within the healthcare setting can be very quick, and everyone is very time pressured, and you're a lot of the time you're focused on a job or a task at hand. A lot of the problems with that trans people face in terms of receiving services are about being misgendered. So correcting that is a matter of just very quickly saying that sorry, that they're they. Can you stop referring to them as she? It's just one or two words, and it's an interjection. And the other way that's been covered has been the kind of softly approach. Well, I noticed that you were talking about this patient colleague in this particular way. Did you realise how much that affected them, and that it's very important for that person to be respected, and just giving some background information about what might be happening for that person, so that you're encouraging compassion and empathy rather than snap judgments. But it is very, very difficult. I mean, I work with a team of nurses, and we've got a non-binary doctor with us and they're brilliant. They're out as non-binary, and although they were very supportive of going to their mandatory trans training, when faced with a non-binary doctor, they often misgender them, and it's very, very frustrating.
Thanks, Becky. And I think that frustration is something that's shared by most trans and non-binary people I meet working in the NHS, that many of us know some fantastic allies and some fantastic colleagues who are supportive and who want to make sure we get it right. But it's that consistency that we actually want to see, and actually that environment in our med schools, so that people do feel comfortable in speaking up and challenging. And we've heard from Laura and Lucas around the barriers that they experience in feeling able to challenge, despite having colleagues and friends who are supportive. So I hope that we can get to the point in future where we're not having this same conversation, and that we have less of that frustration and more of a celebration of the progress that we've made. But I think that's going to be a long time in coming at the moment. I'm going to move us on to the next discussion and then the final discussion for today. And this is really looking ahead to the future, and really what we're here for, which is how do we make a future where we have more trans and non-binary doctors, more trans and non-binary people feel comfortable and open and able to be out and to be themselves at med school and within our workforces across the NHS. But at the moment, we're seeing a rise in transphobia in our communities, in the media. We're not seeing those visible role models in senior roles across our NHS, other than a few individuals scattered here and there. So there's some real challenges in how we shape and build that future. And I just wanted to ask Lucas and Laura to maybe share their perspectives on what we can do to make our medical schools be a place where more trans and non-binary people A, feel they want to apply to, but B, that we remove the barriers that are stopping trans and non-binary people joining and accessing a medical profession. So either Lucas or Laura, if one of you feel you'd like to come in.
I'm saying this very much with a smile on my face. I suppose there's two things we need to do. there's the first in the general sense, right? I think probably, you know, in the same way that, you know, if you want to improve the outcomes of trans people in any sphere of life, what we need to do is improve the healthcare standards for trans people. If you want more trans and non-binary medical students, I would advise you write to your MP about GRA reform, because if that GRA reform gets reversed, that means more kids get to access puberty blockers, which means better outcomes for them mental health wise, which means better outcomes in terms of their attainment, which means more able to apply to a medical school, which means more able to become a doctor. That's where it all starts fundamentally. That, you know, kind of, and again, that is very, you know, that's very systemic and everything else. And I think kind of the sort of the micro, do you know what I mean? The personal that we can do in terms of, or, you know, that medical schools can do is, I think, make explicitly part of teaching, do you know what I mean? And part of the, sort of part of this patient spectrum that you teach about non-binary people. I mean, and again, it's not that, I suppose we have to be very careful here when we talk about this, that we, you know, we don't want tokenism effectively. We don't want people being put in for the sake of it. We want it to be genuine and sincere in the intent, you know, that they have for that. But I think if I tell you what, there you go. It's a bit of a non-answer, but what medical schools can do to support trans and non-binary students, it is known trans people generally, and medical students, mind you, have a much higher incidence of mental illness. You know, they're much more likely to have to struggle financially, to be socially excluded, to lack familial or other support. You know, if you, and the way, in a way, if you want to help trans and non-binary people specifically, is make sure that the support systems, the pastoral structures, you know, the people that they would need to help support them through that are there in the first place, I would say. Because I was just going to ask Lucas to come in, building off what you said, Laura. Lucas, what are your thoughts in terms of how do we build that future where there's less barriers for trans and non-binary people to access a medical profession?
Sorry, I was muted. I think for me this all comes back to like needing to question the many systems of marginalisation and oppression that the medical system can perpetuate. Because when we say look at just trans people, or just trans and non-binary people, and how we are harmed with the medical system, we can't do that in isolation, because so many different things come in. When I experience transphobia, very often I'm experiencing misogyny. When I all these different things interact, and the harms of ableism, of poor provision for mental health care, all these things interact and are very often perceived or educated about through or within the realm of transness, but it is much more broader reaching than that. And so I think we overall need to question what harms perpetuate, because so often not just me and my trans medic mates, but other people who we aren't represented within the medical, doctors as a profession, but also aren't served well by medicine. We question where do we all go? At what point do we realize that this isn't working for us? At what point do we kind of resolve to accept that we will be participating in a system that harms us? What happens there? How do we deal with that? And this comes up in so many things. It comes up when we are more likely to need support, as Laura mentioned, but then we have to educate before the support is available for us, before it ceases to harm us when we need it. When universities are perpetually investing in systems that do not serve our well-being, do not protect us, and if anything actively harm us, both in terms of down to admin systems, we're not considered within university systems, within education systems, within the healthcare system. And so to go back to the first question, I don't think our NHS organisations are prepared to support us. And I think really need to deeply question, not just with trans people, not just with the notion of like a thin, able-bodied, kind of like cis-assumed white trans person. We need to look at all the systems of oppression which act upon our bodies and our existence and consider them deeply in order to actually make a change on that. Sorry, go on, Laurie.
This may be, I know Chloe wants to get in on this as well, and hey, this is just my personal flavour. As I mentioned before, again, same as very much with a smile on my face. Doctors really like to be smart. They like to think they know things, and generally they're terribly insecure about being wrong. Do you know what I mean? So genuinely, most doctors that I have talked to it about, if you tell them you are scientifically incorrect, right? The issue of like how you treat trans people is not an issue of your social mores. It's not, because I think you know, there are many areas in which we can see like doctors, drug addiction's a good one, do you know what I mean? In which I've heard, you know, some very interesting explanations and explications for the addiction, for the disease of addiction, do you know what I mean? And it is much easier to like, or for me, like it was in those instances, it's much easier for me to challenge that medically than it is to challenge it socially. So for example, so like, you know, as a if I try and have a conversation with, say, a consultant, okay, and they've misgendered a patient, I can go and say, you shouldn't say that, you know, as so, you know, kind of, oh, it's it's trendy or topical or isn't a big deal. Well, it's like, okay, you know, we can argue that humanistically, do you know what I mean? Because me, as all of us here can sit here and go, well, you should, because that's a, you know, that's a person, you know, they deserve that. It's in terms of their identity. Sometimes, sadly, it is easier to go, hey, did you know that, you know, Barry, H.M. Barry, as in the performer of the first cesarean section, was a trans man? Did you know that, you know, gendering someone correctly can reduce the, nearly swore, can reduce, you know, in children, the likelihood of certain adverse mental health outcomes by something like 80%. Do you not basically point it out to them? You're wrong. You are scientifically wrong. There is, you know, there is updated, good quality, you know, extensive evidence for the validity, you know, existence, and also, you know, kind of the things that help trans people. Remind them that, you know, this isn't about, you know, being sort of not down with a trendy new thing. This is you having a gap in your knowledge base. That, in a way, is more of a challenge to, I think, consultants, you know, people who have that vested power structure, who are people who, you know, benefit from that. And again, there are interesting ways to have that. Obviously, if you go up to a consultant and be like, you don't know anything, probably not going to go very well. Do you know what I mean? But there are ways to have the argument that do not. And also, I find that a lot easier personally as a trans person, because I'm not talking about my existence. I'm not having to sit here and go, no, you shouldn't misgender that person, because if you've misgendered them, that's, you know, there's no difference. If you feel that way about them, you could do that to me, right? If what we're having a conversation about is you don't know your science when it comes to transgender healthcare, that's a lot easier. You know, that's a conversation in which, in a way, sometimes people can be more receptive to criticism. So, you know, and again, and this just as a final point, because I do talk a lot, and it comes back to what I said about the sort of challenging the paradigms and the ways in which transness is sort of thought about by healthcare professionals. There is an assumption, I think, that doctors know better than trans people about being trans, number one, and also that sort of oh no, point's gone. No, yeah, basically that they know better, and I think that's what needs to be challenged.
Yeah, I think Laura's absolutely right, and you know, it's.
I remembered. Sorry, after you, Chloe.
No, go on. Go ahead. Go now.
Yeah, and oh God, I know we're just about to finish, so I don't want to be too doomer, sort of, or too much of a down note, but like, it has been mentioned with these are difficult times. And even if it's just something to take away, right? Of the trans people that I know, oh, we have half an hour, don't panic. You know, of the trans people I know, yeah, I'm trying to think, every single one of them, private healthcare. Because they can afford, because, you know, they do a lot to try and afford it. None of them have ever had a GP. None of them, sorry, as in a supportive GP. None of them have ever, you know, all of them have stories of being misgendered, of being everything else, and in particularly, like problems with psychiatrists within psychiatry, which, like, as someone who's also very interested in that, wounds me deeply, you know, and further compounds I think the issues and the, yeah, exactly. Who doesn't? Because, you know, we all, sorry, I'm responding to Tyver's comment, which is that it's felt unsupported when it comes to trans care. Who wouldn't? You know, as far as I know, very few of the GSCs have even really opened back up after COVID. And, you know, they're not updating the waiting list. They're getting longer, not shorter. I said this to a colleague of mine, so a colleague who works in sexual health. They asked me effectively, why, you know, what the barriers are, and basically, and excuse my language, but it's quite a speech, which is basically like, I don't trust you. I don't trust anyone who looks like you, and that's because you've got a badge on. You're the doctor. Every other doctor I've seen before you, you know, the 10 doctors I saw before you weren't nice to me. Why should I trust you? Do you know what I mean? And it's very hard in that instance to sort, and again, that's with the people who bother to turn up. Our real problem is how many people, and again, it's very much a, I think, a sexual health sort of style conundrum in how do we, the people who we most need to reach, and it's come up again, trans people of color, you know, kind of trans people, non-binary people, people who might feel excluded or disincentivized for whatever reason to access or declare themselves somebody like that, sort of to a medical professional. That's, I think, again, I don't have solutions to that, but
it's a really good point, Laura. Like the sort of lack of trust from trans people towards medical professionals is completely understandable, and yeah, you know, I think that's where doctors really struggle, and it circles back to Pranathi's point as well, just saying, you know, how do we sort of address these things in, you know, what if we go wrong, or, you know, what if other people go wrong? You're never going to win the argument 100% of the time. You just have to accept that you will be wrong, other people will be wrong, but the most important thing is that you apologize for that, you recognize that, and you apologize for it, and you recognize your shortcomings. And I think we've got Kate Nambiar wants to come in.
Hey, hi everyone. Just wanted to come on a couple of points. So I'm a trans doctor. I was at medical school in the 90s, and yeah, you know, like a lot of people are saying, I faced a lot of transphobia, to the point actually where I decided that I didn't really want to be out, and tried for a long part of my career not to even face up to it. It's taken a lot to actually, you know, to be public and to be out and to try to be a person that you know, stands up for trans people, and actually, you know, tries to advocate for us as a community and for us as a people. And I think it's beholden on us, you know, as the senior doctors, to try to put ourselves into those positions where we can influence and change and make a real difference to our medical school curricula, to our environments around us, and to speak to our other colleagues where there is that, you know, the misgendering is happening, where there's transphobia happening, you know, all the time. You know, I work in sexual health. You know, we have done. We've done tons to try to make it a better place for trans people, but I know there's so much work still left to be done. You know, I chair a special interest group within BASH, our national body, and I'm aware of the amount of people who are coming and asking for more training, or and more information. I think it feels like a mountain that needs to be climbed. One last point, I think Laura raised it just now. I don't want to take up too much time, because I know that there's a lot of other people who want to speak as well. But it hurts when I hear that, about that lack of trust. But I know what that is. I know where that comes from. I also work at the GIC in London. I'm an endocrinologist there, and I see patients who come to see me, and there's that instinctive barrier. You can feel that I don't trust what you're about to say. I don't trust that you are going to be supportive towards me. It takes a lot to break that down before somebody can actually understand that I'm not out there to try to stand in somebody's way as much as I possibly can. Sometimes it means even having to come out and tell people about myself, which I don't feel like I should have to do each time, but it sometimes needs that. And I think that's because we have this legacy of oppression towards us as trans people that's come from the medical profession that is very, very, very hard to dispel. But I want to put out there that there are some of us out there who are trying to do that bit by bit. We've got to start from somewhere. Bit by bit, we are trying to break that down. Thank you.
Thanks, Kate. I think we've got Paul that wants to come in now as well.
Yeah, can I just follow on from Kate's part? I think that's really important, Kate, what you were saying. My name is Paul Galilea. I'm a consultant forensic psychiatrist, and I'm Chief Medical Officer at ELF. And I find the conversation today really enlightening and really positive in some way. I know it's really frustrating where we are with trans and non-binary healthcare at the moment. But 30 years ago, I was at medical school and a gay man. And at that time, to come out as a gay man was really difficult as well. We were hitting HIV, we were going through lots of things, and I never thought 30 years ago it would be possible to be a successful doctor and also living as an out gay man. And 30 years, a lot of things have changed. I never thought I'd be a successful doctor. Neither did I think that I would have a long-term partner who I would subsequently marry and be with for the rest of my life. Things are changing, and what I hear today here amongst the medical students is that there is real hope there that we can change things for trans health and for non-binary people as well. And the one thing, I think, Tara, you mentioned this earlier on about how can you get the voice heard. There are lots of us here who are trans allies who will help and try and amplify your voice as much as we can through our own power and position and privilege. But we need to bring you up along with us as well.
Thanks, Paul. That's a really nice segue onto a question I was going to ask Chloe. As one of the points that's on the screen is actually being an ally is something that we discuss, and allyship is a concept discussed right across a whole range of communities, not just for trans and non-binary people, but actually knowing what you should do as an ally and knowing what you're doing is being meaningful and impactful and isn't speaking over trans and non-binary people is equally important. And so I just wanted to reflect, because I know how much work you've done, Chloe, and from talking to you myself as a trans person, been impressed on your allyship and what you've done to centre trans and non-binary issues within your work. What's your message to medical students that are thinking, I want to be a trans ally, but actually I'm not sure exactly what I need to do? What would you say would be your message to them, Chloe?
I think the most important thing is to listen to your trans peers, and if you don't know where they are, then go online. The internet is a wonderful resource. There are so many people, as we can see by the number of people here today, there's so many great people online who can teach you so much, and that's definitely how I did a lot of my learning. I was very lucky that I had a really, really good group of friends at med school, many of whom are trans and non-binary, and they taught me a lot, which actually enabled me to be able to go and put the first resource that I made together in the first place. And without them, I wouldn't have, well, let's put it this way, without them, I would have done it, but it would have been terrible and probably full of errors. And I'm not saying that it's perfect by any means, but there's no way I would have done it without them. So to my other med students in this chat, and you can go forward and tell your other med student friends, you've just got to listen and educate yourself. And they're always telling you in med school, there's more that you don't know than what you do know. So it's exactly the same with this. There's so much that you don't know, and that's fine. You're never going to know everything, like none of us ever are. But just recognise when you're sort of straying into waters that you're not comfortable with, and there's always someone who's going to reach out a hand to help you. When I've found something, I've come across something in my research, or something's sort of happened on social media, and I've like, oh, I've not heard of that before, or I want to be able to post about this, I want to be able to discuss this, but I haven't got the background to do that. I go and find someone who does. It's exactly the same as what I do at work. I'm a junior doctor in surgery at the moment. I'm no surgeon. I don't particularly ever want to be a surgeon, but I have to deal with a lot of surgical problems. And if I don't know how to deal with those, I go see my registrar. And if the registrar doesn't know, they go and see the consultant. It's all about finding those connections and helping, and there's no shame in saying that you don't know at all. So yeah, listen, educate yourself, and don't be ashamed of what you don't know.
Thanks, Chloe. And I think one thing I'd like to add to the direction of travel of this conversation as well is that we're doing this as well to improve healthcare for trans and non-binary people. And if we've got more trans and non-binary people working as doctors and as clinicians within our services, and they're going to bring those different experiences, those lived experiences, those perspectives that we know aren't in the room at the moment when it comes to the decision making, always around our specialist gender services, but also the complexities of trans inclusion within mental health, within sexual health, within maternity services, and the whole spectrum of healthcare that we work in. So actually, whilst this sounds like a workforce discussion and it sounds like an education discussion, actually the reality is that this is about improving healthcare for our patients and making sure that trans and non-binary people have a better experience when accessing healthcare in this country. So it's vital to that agenda as well. I know what we wanted to do now was really open it up to questions and discussion from you that have listened to some of the conversations we've had already. I know we've had a lot of chat in the chat box, but really it's your chance to put your hand up now and ask anything you want of any of us that are here who've been talking, or you just want to say something about what's been discussed today, or share an experience about the importance of trans inclusion within medical schools. So just open it up and see if anyone wants to put their hand up and contribute.
Give people a bit of typing time. I'm just looking at the bits on the chat that are sort of asking about how to make it clear that you're an ally. I know lots of people have struggled with the sort of NHS rainbow badge and things, which I've met Mike Farquhar, who set that up, and it is a really great initiative, and when it works it's really fantastic. Obviously we've sort of got the issues at the moment with the NHS rainbow generally for COVID, and I'm sure we've all got our own opinions on that. In terms of what you can wear, I mean, sort of, you don't necessarily have to wait for a NHS authorised trans yard to come out. If you've got like a little badge that you want to wear that's got a little trans flag on it, or you want to write your pronouns on your name badge at work, which is what I've done because they won't put them on for me, so I've just taken a little marker pen and written them on. Even so, I know it's a small thing, but for some trans people that's really good. And even if that trans person doesn't come out to you, you don't know they're trans, they don't know that you don't know, it doesn't matter. They feel comfortable in sort of being treated by you.
I know there's some colleagues on the call today. I don't know if they're able to join, if they're at their screen, that work that's been done with the Hello My Name Is badges work nationally to make sure that pronouns are included. I don't know if anyone wants that's on the call that's been involved with that might want to share. I'm just trying to look through the speakers list. If you do speak up now, that would be fab. Michael, great.
Hi, all. Really great discussion. I'm really enjoying it. I'm actually not going to take the credit because I think Eddie's on the call. Eddie's put their hand up, so I'm going to stop talking because I got in first. There you go, Eddie.
Hi. Yeah, sorry, I'm like on my bed. Yeah, so this is a project that I've been working on since I think February or March this year, and I've been working with Chris Poynton, who started the Hello My Name Is badge scheme, with his partner Kate, who sadly passed away, to work with all the official merchandise providers, and now I'll put the link in the chat, but you can get your pronouns on your Hello, my name is badge from any of the main providers. And that's just like a really quick, simple way of kind of demonstrating that you're open to creating an inclusive environment for trans people. Also, if you can get one in time, our colleague Tash has been doing some work for International Pronouns Day, which is the 21st of October. And if you can, it'd be great if you could take a picture of yourself with your Hello, my name is badge with your pronouns on, and post it on social media. That'd be really cool.
Thanks, Eddie. It's such fantastic work to see that progress and that visibility, and the fact that people will be able to talk about pronouns in a way that it's more mainstreamed. It's not something that just brought into discussions around equality, and so it's a real massive achievement to see that happen across the NHS, and I'm excited to see those badges rolled out across the country. Gorgeous, we've got some other hands coming up. So I've got Becky.
Hi, yeah, just sharing a couple of anecdotes. I've got a friend who was in hospital for a UTI, and there was some discussion. She was later discharged and had to have a follow-up appointment, and she didn't get the follow-up appointment because the clinicians were undecided, although she's the lady who's had GRS, undecided as to whether to stick her on the male list or the female list. So she just got lost in the system, and that's something that's quite common, unfortunately. My partner currently has a GP practice who are quite transphobic, so basically getting the care from them is very difficult, and it's causing actual harm to her. So she takes MST regularly. She needs Movicol. They've stopped prescribing it for her because they said it's you can't prescribe it anymore, and have not offered an alternative. And so therefore she's now being left with quite an obstructed bowel that we're trying to wash away with bought Movicol now. But it's just to say that the trust levels that you discussed before are real, and sometimes harm can come of other patients. And I think it's kind of, if you're presented as a doctor with a case where you can see that someone's been clinically negligent, then it's something that I think is important to raise with their GP practice, because I think, as trans people, we can call it out as much as we like, but it's not going to make any difference unless it's a peer saying it.
Thanks, Becky. I think we've got Irk that wants to come in.
Hello, thanks a lot for that. I was just wondering, with regards to medical education, who is the responsible body for this? Would it be the Medical Schools Council? Would it be another body? Who would one go to flag concerns about non-trans inclusive medical education?
I think for various medical schools are sort of, as far as I understand it, independent in terms of the way that they organise a lot of their curriculum. So in the first instance, you would probably be best going to your medical school and being like, this is a gap I see. Obviously, then if they're not going to be very helpful about it, then yeah, there's the medical school council, there's the BMA. BMA are always, sort of on hand to help you access help for this sort of thing. Or
sorry, what does BMA stand for?
The British Medical Association. So they sort of govern a lot of legal stuff that goes on in the UK in terms of medicine. There's also the student BMJ committee, so the British Medical Journal. They have like a student branch, and they are also really sort of active on social media and easily contactable in terms of how you can sort of get problems raised and flagged up and things.
Thank you.
If I may just quickly jump in, just because there's a symmetry, I think, between the questions that are being asked about, we know you know, is there a centralized authority that should be, do you know what I mean, kind of helping or sort of facilitating this structural change? And like in the case of both, you know, the Royal College of GPs and medical, you know, the Medical Schools Council both turn around and say, oh yeah, no, absolutely, we're 100% for trans healthcare. You know, we want everyone who's associated with it to do it, and then many don't. And, you know, in the case of the GPs, it's because of the fact, you know, the sort of franchising system wherein, you know, kind of they're allowed a certain, probably correctly, a sort of certain element of independence, sort of in the way that they're allowed, you know, they practice in medicine, and that which they do and don't sort of offer, you know, flying in the face of their guidance, mind. But, you know, I think a similar sort of argument is made by medical schools, and I think a really good point was made earlier on in the chat about saying that you know, kind of all we're asking medical schools and GPs to do is to acknowledge the actual, you know, the reality of the diversity of their patient base, you know, or the patient base that they're teaching their students to treat.
Thanks, Laura. Has anybody else got anything they'd like to come in from listening today, or share their experiences of what they think medical should be doing to become more trans inclusive, or how we can go about encouraging more trans and non-binary people into medicine? No points too small. We're happy to take anybody that's got a thought that they'd like to share.
I'd like to just add in a little bit quickly about you know, in terms of student stuff, if you get stuck, your student unions tend to be quite good as well. I know the one at Birmingham is quite active and has been very helpful on certain things. So if you're struggling with your medical school and it's something that you sort of want to run by your student union, then they're always a free and easily accessible resource as well.
I'd absolutely double that point. As a former sabbatical officer of a student union, I think student unions are an underused resource that we need to celebrate more and actually utilise more, both as partners in the NHS who are supporting many of our healthcare and medical students throughout their education. So absolutely. We've got Nico that wants to come in.
Hi. Thanks so much for the talk today. It's been really great to listen to everyone's expertise. So basically, I'm based at St. George's and I'm a physio student actually, and we're currently working on a Future Learn course that's hopefully going to be open access, and so we're going to be, you know, talking about trans inclusivity in healthcare, and specifically not just focusing on like the medical curriculum, because I'm a physio obviously, so I wanted to be like applicable to my cohort and potentially to OTs as well. So I just wanted to kind of get some views, because I've kind of heard from the talk that I don't want to say like people are against peer-to-peer education, but like I just kind of want to hear your views on like putting a course like this out there, and what sort of like tips and strategies you might have on, you know, making it as good as possible, basically.
Lucas or Laura, do you want to come in?
In terms of, firstly, can I say it's wonderful, like, to hear somebody on a different course talking about this, because it's something I think that can often be overlooked and is, you know, not unique to doctors or, you know, people interested sort of coming from that background within medical school, talking about, you know, only medicine. We need to remember that, you know, for the average patient, they don't spend that much time in terms of getting contact with a doctor. You know, the doctor comes around in the ward around in the morning, everything else. But most of the, you know, the patient actual face-to-face hours is often nurses, physios, phlebotomists, everyone else. Exactly. So that, you know, kind of talking about, it's important that we sort of, you know, challenge these things and have these conversations within medicine, but also within all of the equally important, often more patient-centered elements of healthcare as well. I think in terms of like expertise in terms of how to run that, that's a huge area I don't know much about, but I think Chloe probably would.
Yeah, no, I've just dropped a line in the thing just so that I'll be in touch sort of going forward. I mean, it's a bit of a misnomer, it's a we, it's just me at the minute, but I'm always looking for, you know, people to sort of, yeah, come on board and like help me do my resources and stuff, and I'm more than happy to like help you with that going forward as well.
Awesome.
In terms of sort of experience levels, like I don't think that you're wrong to sort of do this without knowing sort of how to go about it, because it's all part of learning on the job. What I would recommend is just sort of write a big list of all your main points that you want to get in, and then just bounce them off anyone who will listen. That's what I did. Just told everyone and anyone, and eventually I boiled it down to a set of points that were really useful, which is kind of what we've been trying to do with this conversation, really. So yeah, if you want to message me after or whatever, like, I'm more than happy to talk with you about that.
Cool, perfect. Yeah, I'll definitely do that. Thanks.
I think as well, just on peer-to-peer teaching, I'm not like against it generally. I think it's really useful to have its places. I think when it is viewed to be the default on certain topics, that's where I like struggle with it. And when the like it becomes almost like the onus is on the people related to the issue who are like harmed by poor education on it, and that's when I kind of go, this isn't working, because obviously if you want to do it and you're able to do it, absolutely wonderful, but the amount of times that I've kind of had to go, I don't have the energy for this thing, if I don't do it, my education or my life or my like the way I interact with people will be worse. And when you're put in that predicament, like that's where I'm like about it, if that makes sense.
Yeah, absolutely. No, I mean I completely agree with that point, like 100%. Yeah, no, thanks for you.
No, yeah, that sounds really, really cool. Yeah.
I was going to say what's sad, what's quite sad is that attitude that trans people should be responsible for educating our system. Unfortunately, I've seen actually come directly back from staff, and actually from speaking to thousands of staff across the country in different training sessions and engagement activity over my years working in the Quality University, is the amount of people who said, well, trans people should educate us. Actually, if I don't know, I'm curious, well, why can't trans people and non-binary people tell me what it is we need to do? And I think we've also got to get rid of that sort of assumption and that sort of perception that it is a community's responsibility to get health education and to get and upskill people so that they're knowledgeable about trans care. Now, that doesn't mean that actually we shouldn't learn and talk to and have relationships, positive friendships, and engage with different communities. That's part of our cultural competency and developing our understanding of others. But we shouldn't rely on our knowledge from talking to a trans person, particularly as well, because it comes back to, like I said earlier on, I'm me. I'm a white middle-class trans person. I can tell you what my life has been like. Now, it happens that I've also studied discrimination law, worked for over a decade in discrimination and human rights and working on those topics. So I bring knowledge and experience other than being trans. But actually, if you just speak to me because I'm trans, all I'm going to be able to share is my life. And sometimes we need to refocus why we're in that engagement and what we're trying to achieve if we're involving trans people in those discussions.
Yeah, very quickly as well, then, because that leads you to this notion of like what an acceptable trans person is, especially in like through the medical eye, and this completely false narrative of like acceptability politics, in which some people are more valid or less valid or more like suitable or allowed to have treatment than others, and that comes back to a harm. Yeah, I think we just got Becky asking to
come in.
Yeah, thank you, Nico.
Hello, I'm sorry, I'm talking quite a lot, aren't I? I've just got experiences to share, that's all. So I just wanted to raise, because I know we've got allies here, in terms of documentation and confidentiality of trans people. And my partner had an experience where documentation was my friend had documentation on a discharge letter saying, I can't remember the exact words now, saying that she was transgendered or something, which is completely unprofessional. And it was nothing to do with what she presented to hospital with. My partner, similarly from a GP practice, thought it was appropriate to write erectile dysfunction. My partner's a TS woman. It was appropriate to write erectile dysfunction on a referral letter to another doctor. My personal feeling about it is that if people are, I mean, both me and my partner live in stealth, more or less, is that it should have the same level of confidentiality as HIV was, 20 years ago when it was very heavily stigmatized. because we do, as trans people, face so much stigma that sometimes we want to hide a little bit.
You need the agency over that thing. I think that's what it comes back to for me as well. It's just the ability to have agency and choice and control in the way that we interact.
Thanks for sharing that, Becky. And I think that sadly so many trans people have similar experiences out there and stories that people could tell, and actually how big this topic and the issues that we need to discuss are. And that segues us on really nicely to our next steps, and the slide that's on the screen now is that we do want you to continue the discussion that you've been having. Share some of the conversations and your thoughts today using the hashtag #CCTransHealth on Twitter. And we're hoping to host a number of future courageous conversations around other topics and important issues. So if you feel there's something that we should be discussing, like we've heard documentation and confidentiality, or different staff groups that we should be engaging, then please contact us so that we can do that. I'm just going to hand over to Chloe, who's got some thanks. But before I do that, I just want to say a massive thanks to Chloe, who has put in so much work in making sure today actually happened, and actually that the importance and that role of our allies in actually furthering this agenda isn't just about trans and non-binary people fighting for equality. We do this together, and only together will we get equality. So I just want to hand over to Chloe.
Yeah, thanks, Tara. I just wanted to say thank you so much for everyone for coming today and for being so interactive. It's gone way better than I could ever have dared to dream about. And for me, for someone who's been trying to sort of get this kind of thing off the ground for quite some time, it's really nice to finally see it come to fruition. So thanks for that. And I just want to say thank you to Lucas and Laura for being such willing participants in this, and for, you know, putting their own experience forward and helping us come up with some really salient points. And yeah, also to Tara for sort of guiding me in how to run a session like this, and just being generally great and really helpful. So yeah, as she said, carry on the conversation on Twitter. We'd love to hear from you. If anyone wants to email me at 16.6 for, you know, conversations on anything else or collaborations that you want to do, I'd love that. And yeah, love to be involved in anything you've got going on. So yeah, thanks for coming. Keep an eye out for the next one. We will have a next one. Don't know what it'll be on yet, but yeah, and I'll be sending out a feedback form as well, a survey just for you guys to fill in, just so we know sort of what we did well, what we can do better, and what you want to see next time. Gosh, the chat's going mad. Right.
Yeah.
Thanks, everyone.
Thank you so much. Chloe, if actually no, I think actually yeah, I would say as well, just even if it's just personally, I'll put my student email address. Please don't dox me or put it on any lugubrious corners of the internet. But I know people, it's really encouraging to hear people talking about, you know, kind of the in-person sessions and everything else that people are trying to organise. And, you know, insofar as I can and around everything else, I'd be very happy to talk to whoever really. And also that, yeah, I think we've been slightly depressing at times during this. I think as a nice thing to end on, I think it's important to remember that the LGBT community in this country, even just within the realms of healthcare, has faced similar problems of similar scope before. We have scaled similar mountains, and that these things are possible, if slowly and unsatisfactorily. And that, you know, and if nothing else, to see that there are this many people willing to come in and have this conversation and take it further is hugely heartening.
Well, thanks everyone. See you next time.
Bye-bye.
Bye.